Welcome to State of Mind, Being Human and Living Well, broadcasting on KSQD Santa Cruz on 90.7 FM and live streaming at ksqd.org. I'm your host, Debra Sloss, licensed marriage and family therapist, and my pronouns are she, her. Today's show is about tick-borne illnesses, specifically Lyme disease and the mental health effects associated with this complex and often misdiagnosed illness. Ticks are present year-round here in Santa Cruz, California, and Lyme disease is a year-round problem throughout the United States. Yet, April through October is considered tick season, when many of us are spending more time outdoors, hiking or in our gardens and yards, and the likelihood of being bit by a tick increases. This is why we're remixing and updating this interview that was originally recorded a couple of years ago and broadcasting it again now. Results from recent years of the Santa Cruz County's tick-borne disease surveillance program have found that at least 2% of adult western black-legged ticks tested are infected with the bacteria that can cause Lyme. Across the United States, that rate can vary by area from as low as 1% to more than 50% of the ticks being infected with Lyme disease causing bacteria. In the United States, reported cases of Lyme disease have tripled in the past 20 years. And currently, in the U.S., there are 300,000 estimated new cases of Lyme disease each year. There are, however, preventative measures you can take to protect yourself, and you can learn more about these by going to the resource list that's included with the posting for this show at ksqd.org/state of mind. Joining me for today's discussion is Judith, who graciously shares her personal story of living with Lyme disease, and with us is family medicine physician assistant and integrative medicine specialist, Dr. Cynthia Quattro, who helps us learn more about this tick-borne illness and offers information about where and how to get accurately diagnosed and where to find help and support. Let me tell you more about our guests. Judith is a native Californian. She was a serious child, dyslexic, and a musical math whiz who felt more comfortable with animals than with people. After almost dying of pneumonia when she was in college, she says she had to learn how to choose life and to get up every day. Subsequently, she's been living as a pilgrim for justice, peace, and healing. She was exposed to Lyme disease at some point between 1986 and 1990, during which she was part of 2 cross-country and 2 international walks for peace and the environment. Judith was not diagnosed with Lyme until 2002, after years of deteriorating health and an automobile accident, which she describes as potentiating the Lyme disease and making her symptoms much worse. Judith experienced significant improvement in her health during the first 10 years after she began treatment for Lyme. However, after receiving a tetanus shot in 2016, she experienced a major setback in her health and has needed to be focused primarily on basic self-care ever since. Cynthia Quattro is a family medicine physician assistant who specializes in treating Lyme disease and chronic illnesses using integrative medicine. Dr. Quattro uses a systems-based approach to recommend nutrition, diet, and lifestyle changes in addition to more conventional medicine diagnostics and treatments. She's had a medical practice in the Santa Cruz community for more than 20 years, where she treats adults and children. Dr. Quattro has treated many patients living with chronic Lyme disease, mental health concerns, and other long-term illnesses, and she believes that mental wellness is part of a whole-body system health plan. Dr. Quattro is also a doctor of acupuncture and specializes in the gentle style of Japanese acupuncture that supports the immune system and connects the mind and body through interrelated pathways. She lectures and teaches seminars for Bay Area acupuncture programs on the treatment of Lyme disease and chronic illnesses using integrative approaches. Dr. Quattro has written an e-book called Natural Treatments for Lyme Disease. I'm so happy to welcome you both, and thank you for being with us here on State of Mind today.
Thank you.
Thank you.
Yes,
Thanks for inviting us.
Good to be here.
Starting out, I wanted to start with you, Dr. Quattro. You're here to educate us about what Lyme disease is and to provide some information about diagnosis, treatment, and local resources. Can you start by describing what tick-borne illnesses are and specifically what Lyme disease is?
Sure. Thanks for having me on the show, Deborah. I want to give a little bit of historical context. Ticks have been around for a very long time. If you even look at the history of the Egyptian tombs, they would find ticks, inside these tombs, and partially because they have a very hard shell that protects them from their predators. So it's not new. But what Lyme disease is mostly considered a bacterial condition. It's spread by what's called the black-legged tick. There are different species, and we have one species here on the West Coast called Pacific Ixodes. The bacteria itself has a unique shape, or what we call the morphology. It has a corkscrew shape, so therefore it can penetrate deeply into the tissues as it can corkscrew deeper. The other problem with getting bit by one of these ticks is that there are other bacterias, viruses, and parasites that it can transmit.
You mean aside from the Lyme disease itself?
Aside from the Lyme bacteria. The bacteria that we're talking about here is the Borrelia burgdorferi. However, the co-infections that are common are ones called Babesia and Bartonella. Without early treatment, these symptoms that can be transmitted by the tick can become chronic, and that's where the complications come in.
And for those bitten by a tick, what's the likelihood they'll contract Lyme disease?
So according to a vector control specialist in Santa Cruz County, Lyme disease can be found in 2.1 cases per 100,000 people. That's compared to the U.S., where it's 100 people per 100 cases per 100,000 people. Here it's common because the climate, it's warm and wet, and ticks like that. I've heard once that in the Nicene Marks forest that as many as 30% of the ticks are infected with Lyme bacteria.
So there might be concentration areas in our county.
Yes.
Oh, okay. And why do you think it's important to talk about a medical condition like this on a show where we focus primarily on mental health conditions?
Well, I think the problem is that chronic Lyme disease can penetrate through the blood-brain barrier, and it can impact the brain tissues themselves and create chronic illnesses such as neurological conditions as well as mental health conditions. Mm-hmm. And so I think people need to know the progression of the condition. And really the emphasis is it should be treated early, and it can prevent these chronic diseases. Yeah.
Okay, well, I think we're going to learn a lot more about what forms the disease takes. But first, we're going to hear from my other guest, Judith, who has come in to share with us her story about being infected with Lyme disease, how she finally got diagnosed, and how she's learning to live and manage having a condition that's called chronic Lyme disease. Can you tell us how you did come to find out that you had Lyme disease, and how you contracted it and how you started to figure out what was going on?
Well, it's good to be here, Deborah. I went through a long period of declining health. Probably in the 90s, I started having gross motor tics, I have Tourette-like tic disorder. And
so you mean like involuntary movements?
Involuntary movements and stuff like that. This was new to me, and then I also got into abuse recovery, which that was something that started at that time, and then so I was going through that period, and it was kind of bumpy because of those things. And then I had an automobile accident in the year 2000, and then I had occasional problems with my legs starting to give out before that, very occasional. And after that, I started having serious issues walking and a lot of weird neurological things, symptoms.
In your bio, you talked about the accident potentiating the Lyme. Could you explain what that means?
Well, when you have Lyme disease, there's hopefully some balance between your immune system attacking the pathogen, and then the pathogen kind of trying to grow and take over.
Winning out.
Yeah. So there's this little battle going on, and if you're in a relatively normal situation, hopefully that your immune system is winning. When you have like an accident or some other big trauma that happens in your life, that can sort of suppress your body's putting energy into something else, and so then the bacteria starts
to flare
okay. and invade maybe new parts of your brain or whatever. Yeah. Or knees or different people. It basically, my understanding is that the bacteria goes to people's weak points. It can go to people's hearts. There's Lyme carditis is one of the things that can happen. That's fortunately not one of the things that happened to me, but it can do all different things.
So how did you start to figure out what was going on? You were having these really serious events occur where your legs would give out. That sounds pretty scary.
Yeah, and so I was seeing a chiropractor. I had been in chiropractic treatment somewhat before my accident, and anyway, I was continuing with this doctor afterwards, and he was sort of more than your typical chiropractor. He did a lot of testing with kinesiological testing, and as it happens, his wife had Lyme disease, so he was very knowledgeable about Lyme disease. And so at one point he did some testing and he said that's what he thought I had. Did it make sense? Like did you know that you had been bitten by a tick, and did you get like the typical symptoms that they talk about? Like, Dr. Quattro, maybe can I pause you for a moment? Sure.
What are those typical symptoms sometimes that they often say to look out for when you've been bitten by a tick?
Sure. The acute symptoms are symptoms that you might feel like you're getting a cold or a flu. It would be fatigue, achiness, maybe a dull headache. Sometimes you see a rash, but unfortunately in conventional medicine they consider the rash a common finding, but in reality through extensive research it shows really that only about 30% of the people get this classic bullseye rash. The problem there is even if you do get a rash, it could be small and it could be hidden in areas that you may not notice, such as behind the knees or in the axilla or on your back or somewhere where you don't even notice it. What can happen is some people will feel as though they just have this cold symptoms, and it may go away, those initial symptoms, after about 10 days or so, maybe even shorter. Mm-hmm. However, if it's not treated during that window of time, then it can become chronic. And this is where the problems set in.
Okay. Mm-hmm. Yeah, I want to come back to you, Judith, because I was curious. Did you have any of those initial acute symptoms that Dr. Quattro mentioned?
I mean, part of it, in my history, you noticed that I had pneumonia, and I've had respiratory kinds of things over the years. So I look back and I think when I probably contracted it, this is in retrospect.
Yeah.
I mean, I've had a lot of respiratory, things. So, but in the year 1987, I was a part of a American-Soviet peace walk, and we gathered in Virginia and then flew to the Soviet Union. And by the time I got to Leningrad, I was sick, and I was sick for quite a while I was there. And I had not only this cold or this miserable feeling kind of thing that was going on, but then at some point I also got an eye infection, which was something more unusual for me. And I understand that can sometimes be related to Lyme. I had pus coming out of my eye, by the time I got home back to Washington, D.C. Anyway, and it was after that I started having things like the tick, the motor ticks. The gross they were little gross motor ticks at first, and then they became much more obvious. So, and I knew I had been bitten by a tick. But as far as I know, the ticks that I remember being bitten by were not the type that carry Lyme. So, and I understand that it's very common for the people to get bitten by like nymphal ticks that are so small they don't even know they were bit.
Yeah, well, I know that I've taken a few. I live in the woods, and I've taken a few ticks in to have them, to see if they're the kind, and they are so small.
Yeah.
I mean, it would be hard to know almost. They're sometimes no bigger than a small sesame seed.
Exactly.
Yeah.
This is the problem. They can be as small as a poppy seed. And once they bite, they could fall off too. So you may not always see the tick embedded for a long period of time before you find it.
Yeah.
The other problem is the removal of the tick. Once it's embedded, oftentimes it's hard to get out, and sometimes the head is left in. So the most important thing to do is when you get a tick bite is to use the tweezers and to pull back on it directly from the head, and not to use oil or a match or a cotton ball with alcohol, but really just to grab it with the tweezers as best you can to remove it and to keep it. To be able to identify it is an important way of knowing that you have the potential to get Lyme disease. The Lyme tick has a copper-colored shell, and this is a key finding for especially the West Coast tick. And you can put it in a Ziploc bag with a cotton ball, and a damp cotton ball, and send it off to one of our resources here, which is the BayAreaLyme.org website, and they do free tick testing, and they will also test it for the co-infections as well. And this will give you an idea if the tick that you were bitten by was infected or not. And it's important to know what it does look like so you can identify it, because perhaps it's not a Lyme-carrying tick, such as the dog tick, which has a white color on the back. And there are other ticks, too, that are not infectious.
Mm-hmm. Judith, coming back to you, so when you were finally diagnosed by this chiropractor, did it all make sense to you? Did that feel like it put a lot of things into perspective, or what was your reaction to that?
I would say that I've generally been a complicated patient for people who deal with complicated patients. So it's hard to, sometimes it's just been a struggle to figure out what is going on. And it was sort of hopeful. It's sort of like, I have, if it's this, maybe I can do something to treat it. So it was hopeful, but it was also frustrating and difficult, because he knew that I needed antibiotics, but he was a chiropractor. He can't give me antibiotics. He could do certain things to support my treatment, but he really encouraged me to go try and get a doctor who knew how to treat Lyme. Mm-hmm. And the one that he knew, the one that his wife went to, was in Reno. And I went to see him one time, and he confirmed the diagnosis, doing just a clinical examination and history, and then I came back and tried to get another doctor to treat me, because I didn't have a Lyme doctor at that point.
You're tuned to listener-supported 90.7 FM KSQD Santa Cruz. K-Squid, many voices, one station. And this is State of Mind, being human and living well. I'm your host, Debra Sloss, and I'm here talking with guests Judith Ain and family medicine physician assistant and integrative medicine specialist Dr. Cynthia Quattro, and we're discussing Lyme disease and the mental health symptoms associated with this illness. Stay with us, and we'll be right back after this brief message from our underwriter.
Family Service Agency provides counseling and support for people of all ages facing life crises and challenges. You can reach them at 423-9444 to see if they can help you. Thank you, Family Service Agency of the Central Coast, for supporting KSQD 90.7 FM.
Back to our interview. I wanted to ask you, you talked about getting diagnosed, and you mentioned that antibiotics might be something that you were needing at that point. What were the treatments that you pursued for once it was diagnosed?
Well, the first thing that happened is the doctor in Reno wanted me to treat also for babesiosis, which is one of the other tick-borne infections, but I don't know. That I had this one test done, which was really more of a study test than a clinical test, that I was able to use to convince the local doctor to give me IV Rocephin, which is one of the main treatments that they use for the Lyme disease.
Is that an antibiotic treatment?
It's an antibiotic,
okay.
Yeah, IV.
Mm-hmm.
And so I did that for, I don't know, I forget, maybe 2 or 3 months. I forget exactly. Mm-hmm. Where you have to get a PICC line that's it was inserted around my elbow and up into the heart, to give me the antibiotics.
So let me ask Dr. Quattro, is that typical to have, so if you had a PICC line, it means it was a long course of antibiotics.
Yeah.
Is that a typical treatment, or can you speak about that a little bit?
Sure. I think speaking about treatment is important. I think in acute disease is the most important time to actually get treated. And soon after you have a tick bite, there's some controversy about how to be treated when you first get bitten by a tick. But the Lyme literate doctors, which is also one of our resources, the ilads.org website.
Can you talk about that before you go on? What
Sure.
is a Lyme literate doctor?
So a Lyme literate doctor is one who's been trained by doctors who have the experience of treating chronic Lyme. So they have programs, training programs for providers to learn, what's the best way to treat. There are some providers that have not necessarily gone through the full program, but they have been trained, through experience and through conferences, various other ways to be informed. But the website will list those that are certified, I guess you might say. Mm-hmm. I myself studied with Dr. Stricker, the first president of ILADS, before they started having the training programs. So I've got my experience starting from there. So their main point, I think, in terms of after an initial tick bite, is to get treated right away. And this would be some form of antibiotics. And the course of the treatment should be longer than is typically prescribed. For instance, I've known people to go to urgent care and they'll get 1 dose of an antibiotic, and it's considered to be the treatment for a tick bite, which is found not to be adequate. The course typically should be at least 10 days, if not up to 3 weeks of an antibiotic after having a tick bite. Some people choose to use herbal antibiotics instead of a prescription form of antibiotics. This gives you some time before you can get a test done, for example. However, when you have a test done, it has to be some time, at least 4 weeks, if not longer, after you've had the tick bite for the test to be positive. So there's this lag time, which is important to be treated, during that time.
When you say the test has to be positive, meaning to show again that you still have Lyme disease? For an initial blood test after you have a tick bite, it should be after the tick bite, after 3 or 4 weeks of having been bit. So it's not positive. The tick does not necessarily show antibodies in the immune system for some time. It takes time.
Some time,
Mm-hmm.
exactly.
Because the test for Lyme tests for the antibodies to Lyme, so your body has to have time to make the antibodies before it'll test
in a
positive.
high enough concentration for them to show up in a test.
It doesn't look for the bacteria proper; it looks for the antibodies.
Got it.
So that crucial period of time between the tick bite and when a test would actually show positive is important for treatment. Mm-hmm. And this is a struggle for people because most conventional doctors don't treat adequately, and some won't treat at all unless you have a rash. And if the rash only shows up in about 30% of the people, that's a lot of people that's missed to get treatment.
So all the more reason to try to find somebody that is Lyme literate, right, who might see the bigger picture in this way. And I want to make a clarification because I know when we were speaking, in preparation for you to come on the show, you really made this distinction between acute Lyme disease and chronic. And so right now what you're talking about is the acute phase, right?
Yes, this is the acute phase,
Yeah.
soon, after the tick bite.
Mm-hmm.
What happens is that if it's not treated, then it can progress and become chronic Lyme disease. And of course, this depends on many things within that person's individual system. For instance, the status of their immune system, or even their genetics play a part. Lifestyle, their diet, many things play a part in how one person ends up with chronic disease and someone else may not.
So, in terms of talking about the mental health symptoms that are part of it, to what extent are those part of the acute and or chronic phase?
So typically the mental health symptoms occur once they are in the chronic phase of Lyme disease. There was a study done at Columbia University. Dr. Fallon specializes in psychiatry, and he found that 1/3 of the psychiatric patients there showed they'd had a past infection with Lyme bacteria. And overall, they say about 20% of the Lyme patients, the chronic Lyme patients, show either mental illness or a nervous system disorder.
So those are the kinds of symptoms that Judith was describing about those sort of neurological.
It can start, the mental health symptoms can start as just a more persistent fatigue, or they may be more depressed or just less happy than they used to be, or less enthusiastic than they used to be. It'll be subtle. It'll be a gradual onset. There may be more irritability or agitation. Even attention deficit has been associated with Lyme disease, even psychosis. In the advanced stages of chronic Lyme disease, there can be cognitive decline and then the neurological symptoms that Judith was explaining. But I'll tell you one symptom that I've seen commonly run through patients with chronic Lyme disease is a sleep pattern disturbance and insomnia. And this has been shown to be a pattern with many chronic diseases, but especially with Lyme. And then, of course, if you have sleep deprivation or lack of good quality sleep, then this further suppresses the immune system and increases the chance for further conditions or diseases.
Would you say that's a tactic of the disease in a way to weaken the system so it can flourish, or?
Sure, I think it's a competitive bacteria. It will suppress the immune system over time.
Can you describe, because it sounds like that might be one of the first symptoms, besides knowing someone got bit by a tick, is starting to have sleep problems. How does that show up? Can you talk a little bit about what that typically looks like?
Yeah, well, it can start off just by being more irritable and having difficulty falling asleep at night. And the other patterns would be, for instance, someone may be so fatigued they will fall asleep, but then they'll wake up during the night frequently and perhaps not be able to go back to sleep. And they'll wake up unrefreshed in the morning, drag through the day, and it just sort of further perpetuates, this chronic fatigue syndrome. The mechanism there is interesting because if without good sleep, essentially it creates more inflammation in the body, and this is how it perpetuates the further worsening of the chronic Lyme bacteria by creating inflammation. They've done studies where they look at inflammatory markers in the bloodstream and found them higher. These are these interleukins that they can measure. So there's a clear association between sleep deprivation and chronic inflammation, which only further exacerbates chronic Lyme disease.
Well, that's tricky because inflammation is also seen as connected to a lot of mental health conditions, right? That and sometimes by reducing that, people's other symptoms like depression, anxiety might improve.
Yeah.
So, do you find, Dr. Quattro, that people use a range of treatments? That there's not like one thing that you do to treat Lyme disease?
There is a mixed array of treatments for Lyme disease, but the core treatment is using some kind of antibiotic if it's not a prescription and herbal antibiotic. But then in addition, because I practice integrative medicine, I'm always looking to help enhance the body's immune system too, or resupply deficient nutrients, or review diet and see if the diet is not working for them or creating more inflammation. So
or not supporting the immune system very well.
Or not supporting the immune system,
Mm-hmm.
and perhaps encouraging more inflammation. So these are just some of the treatments, along with I always recommend some form of body work treatment. If it's not acupuncture, some type of massage or body work or osteopathic or chiropractic, something, because the Lyme disease or any chronic disease gets tangled up in the body tissues as well, and that needs to be treated as well. So I use a very gentle style of Japanese acupuncture, and this helps to support the immune system and helps just move the energy around. Plus, it's very relaxing and puts the body into a healing state of mind by shifting the brain waves into an alpha state.
Which, that's true in mental health, too, that we almost always recommend people, find some form of exercise or relaxation, whether that be meditation or yoga or something to reduce their stress and improve their overall health. You're tuned to listener-supported 90.7 FM KSQD, K-Squid. And this is State of Mind, Being Human and Living Well. We're also live streaming over the web at ksqd.org. You can find the podcasts of all our shows on Apple Podcasts, Google Podcasts, Spotify, Stitcher, and on the KSQD website or your home smart speaker. In case you're just joining us, I'm your host, Debra Sloss, and I'm talking with guests Judith and family medicine physician assistant and integrative medicine specialist, Dr. Cynthia Quattro. And we're discussing Lyme disease, the mental health symptoms associated with this illness, as well as how and where to get tested and find help and support. I want to be sure that all our listeners know that every State of Mind episode has a resource list posted on the ksqd.org/State of Mind webpage. Now, back to our interview. So Dr. Quattro, earlier in the interview, we were talking about the difference between acute and chronic Lyme disease, and we've talked some about the treatments for acute, when you first get bitten by a tick and in that immediate aftermath. But I'm wondering if there's more you want to say about the treatments when somebody has what you call chronic or long-term Lyme disease conditions.
I think a lot of patients are confused if they have Lyme disease or not. So the first thing for someone that's listening that's not sure if they have Lyme is that there is a questionnaire that you can fill out that is online. It's one of our resources that can be accessed, and it's called the MSIDS, which stands for the Multiple Systemic Infectious Diseases Syndrome Questionnaire. And this questionnaire was designed by Dr. Richard Horowitz, who is a Lyme specialist and practices in New York, in upstate New York, where he has seen so many Lyme disease cases, and has written a very good book called Why Can't I Get Better? And it's very thorough. And he's designed this questionnaire that helps you check off symptoms that you have and then score it to determine if perhaps you really do have chronic Lyme. I think maybe that's the first place for people to start if they're not sure if they have chronic Lyme and haven't talked to anyone about it so far. Because Lyme treatment, chronic Lyme treatment, is complex, meaning that sometimes the antibiotics are used in pulsed-like patterns. In other words, they may take antibiotics for a period of time, take a break while the bacteria goes into a different phase, and then maybe restart the antibiotics. And in the meantime, use treatments for immune support, for anti-inflammation, and also to treat any underlying conditions that may be prevalent, as I'd mentioned earlier, perhaps a digestive disorder or hormone disorder, treating other things. So it's a integrative medicine approach to treating chronic Lyme successfully. From what I have found, not only antibiotics are necessary or for it to treat chronic Lyme. It really needs to be a broad spectrum approach to treat the whole body.
And from some of the people that I've talked to that have chronic Lyme, there's also a whole aspect of how do I learn to live with this? And Judith, I know you have learned a lot of things over the many years that you've been experiencing this. And do you want to talk a little bit about what it is, what you have done to learn to live with Lyme disease?
Well, one of the things the Qigong has been really wonderful, but other kinds of meditative practices have also been very helpful. Like I deal with a fair amount of pain related to the Lyme disease. And one of the things that I found that was very helpful is there's as a recording, it's a mindfulness meditation for pain relief, but it's basically using MBSR, the mindfulness-based stress reduction techniques, for dealing with pain. And so, I mean, part of it. One of the things that's sort of basic about it is sort of like, how can I be with the pain without making it worse? Sort of be present to it. Just let it be, and not sort of react against it. Which is, I think, one of the things that's a problem with pain is sometimes we feel it and we kind of brace up against it, and that's not necessarily helpful.
Physically, that's true, but also mentally, we have all these ideas like, well, this shouldn't be happening, and why is this happening now? And that tends to exacerbate people's suffering too.
So, in the sort of Buddhist way of thinking about things, is sort of like you have something like a pain, and then you shoot yourself with another arrow. It's like pain's like one arrow, and then you kind of react against it with whatever, and it's sort of like, okay, let's just deal with one arrow at a time instead of, and so being with it and allowing yourself to breathe into it and notice it, and sometimes breathing into it and noticing it, gosh, there's a little anger there, or there's a little sadness there, or there's a little scared, and there's different things that I notice that can be in the pain in different parts of my body, and just be there, notice it. So that's very helpful. One of the other things, I tend to be fairly isolated. Partly, my personality is sort of like that, is happy enough with that, but also because it's hard to get out. It's just hard to, deal with all I have to do for my recovery, and then to do something else too. So it's sort of two things. But one of the things that I really have found helpful is there's a program called Good Medicine, How to Turn Pain into Compassion with Tonglen Meditation by Pema Chodron. And basically, a basic aspect of it, and I have a link to a couple of YouTube videos of her giving this presentation. And basically, it's sort of like one of the things that there's more to it than this, but noticing that I have this pain or anger or whatever it is, whatever the disagreeable thing that is that you're noticing at the moment, and to notice that there's a whole lot of other people. There's a whole bunch of other people that have this exact same pain just right now. And I'm not alone in it. I'm not alone in it, and I can make a decision I'm going to be with this in a way, and hopefully try and be with this in a way that helps to heal us all. And to choose that kind of to choose. Part of it is I'm going to be willing to be happy with where I am.
Because this is what's happening.
This is what's happening right now. To try and to one way and another choose it. Doesn't mean I don't get annoyed, but but just again and again try and make to choose to be where I am, and to notice and appreciate the the good things in my life. And one of the things that I use in conjunction with some of these meditations that I was talking about is heart math. There's heartmath.org and heartmath.com that they talk about some basic practices. The quick coherence technique. It looks at ways of improving your cardiac coherence, and when your cardiac coherence is in a good high or good level.
It's a biofeedback kind of program where you can actually see how you're physiologically responding to changing.
How your heart is.
Your internal.
I think they don't call it biofeedback, but that's in a layman's terms. That's kind of what it is. Yeah, and basically, if you get the technology, I've used the technology over the years, and I find it very helpful because sometimes I might feel like, I'm in a pretty good space, and then I notice my coherence is not that great, so it helps you to really know when you're really coherent. Mm-hmm. And I use that. That's one of the things I also use with it that can be helpful in pain management.
Mm-hmm. So I'm just going to interpret that for our listeners. It's a tool, I think, to learn emotional regulation, and it gives you feedback on a screen, right? So that
on a screen, or just with a sound.
With a sound, right?
Depending on which device you use.
Okay, that helps you see when you're actually achieving that state, so that you can practice it.
You can practice it.
Yeah.
So it's that's been a really wonderful thing, and I guess one of the other things that I've found over the years is. Partly the Tonglen is a way of sort of being present with the world, but to try and figure out a way of how can I give, what can I still do? How can I still be a productive person or somebody who does something, gives something to others, and I guess sometimes my singing, I write little songs and I share that in places where I can, and
in fact you shared one with us today.
And then another thing is I make little origami birds that I just give away. I make them to give them away, and it's just a way of sort of reaching out. And when I remember there was a time when I felt like my life was like this little postage stamp size. I could barely get out of the house, and there was this conference that I heard about. I forget what it was, that I would have liked to have gone to, but I couldn't. So I made, I don't know how many crayons I made and sent them to the people so I could be there.
Mm-hmm. And I know it was a big task for you to get here today for the interview early in the morning like this. So I just want to say thank you so much for coming and sharing your story, because that is a really big way of giving. I mean, this will be a podcast available for people to access and use as a resource. So really appreciate that. You're tuned to listener-supported 90.7 FM KSQD K-Squid, community radio for the Monterey Bay. And this is State of Mind, being human and living well. We're also live streaming over the web at ksqd.org. I'm your host, Debra Sloss, and I'm here talking with guests Judith Ain and family medicine physician assistant and integrative medicine specialist, Dr. Cynthia Quattro. And we're discussing Lyme disease, the mental health symptoms associated with this illness, as well as how and where to get tested and where to find help and support. Stay with us, and we'll be right back after this brief message from our underwriter.
KSQD thanks Santa Cruz County Mosquito and Vector Control for supporting State of Mind. Santa Cruz County Mosquito and Vector Control provides free tick identification, information on tick removal, and related diseases Monday through Friday from 8 a.m. to 3:30 p.m. Check availability at 831-454-2590 or pesthelp@agdept.com. Thank you, Santa Cruz County Mosquito and Vector Control, for supporting community radio, K-Squid 90.7 FM.
Back to our interview. I do know that Lyme is one of those heated topics that frequently there's a lot of misinformation about. So I'm interested to know if there are any specific myths about Lyme disease, Dr. Quattro, that you would like to clarify or do some myth busting about today.
Yeah, there are quite a few, and I'll just narrow it down to three. I think the first one for our local people in this state is there's a myth that we don't have chronic Lyme disease in California. And I think that has been proven by some studies showing that 56 out of the 58 counties in California have had documented cases of Lyme disease. And there's been chronic Lyme disease reported in every state in the U.S. as well. So I think it is definitely here, and the message is to use protective clothing when you're out and check your pets. The next one is that people say, well, there isn't chronic Lyme at all, that it's an acute disease. Unfortunately, the Infectious Disease Society feel that there is only acute Lyme, and therefore they don't typically have a protocol for chronic Lyme. But in fact, it's been shown by some of these continuous testing that Lyme persists and can become chronic, and also using the questionnaire to look at the constellation of symptoms that can show that you have chronic Lyme makes it clear that it does exist. And I think the third one is there's another myth that says once you have Lyme, you'll never be well again. And I have seen enough people and have treated enough to know that it can be treated, and it can be treated successfully. Better the sooner it's treated, the better the outcome. However, I think if with a whole body system or an integrative medicine approach, I think that chronic Lyme can be treated successfully. It doesn't necessarily mean that you get rid of Lyme 100%, but it means that it is under control to the point where your body is well enough to feel well, and you can live a so-called your normal life, the way that you'd like to live your life, and as far as especially recovering from a disability. Mm-hmm. I think that the treatment needs to be focused on repairing the damage that's been done and retraining the immune system. And this can be done with nutritional support, herbal support, acupuncture, some of the other things that we've already mentioned. It may help to think of someone who may live with herpes or hepatitis or even HIV or diabetes. I mean, these are people that have diseases, but they're well managed and can live a so-called normal life. And I think that we can put chronic Lyme into that category. So I think in terms of mental health, it is important to have support in mental health and also to find ways to work or stay on the positive side and have support around you. There's a book that I like that's called Hardwiring for Happiness. It's a Rick Hansen book.
Oh, yeah.
It's a great book because it helps you enhance your feelings and create enthusiasm about your life regardless of what life you have.
Thank you.
Yeah.
I just think it's so important that we talk about this subject, even though this is a show about mental health, because very often in my own practice and also in my personal life, I've encountered a number of situations where people are having pretty severe mental health symptoms and ultimately develop other kinds of symptoms that lead to the diagnosis of Lyme disease. That doesn't always mean that the mental health symptoms just evaporate once that's treated, but certainly they seem to be somehow co-occurring or interrelated in some kind of way. So I personally felt I've had this show on my mind since I first envisioned the show. So I'm so appreciative that I found both of you with your vast experience and expertise to come in and both from the lived experience and also in working and treating with Lyme, to come in and help me and others learn more about this. Especially, my hope is that other mental health professionals will learn more about this so that if they see some things, they maybe can recommend to their clients that they get evaluated or tested.
Yes, I think it's an important topic, and I have also seen patients that are on multiple psychiatric medications that I have found to have Lyme disease. I think it is a problem that mental health providers often don't understand the implications of the disease on mental health. And when the symptoms are not improving, that they prescribe another psychiatric medication, and they end up on a cocktail of medications that perhaps could be treated better by treating the body and the underlying condition.
When you start to treat the chronic Lyme, have you seen that sometimes people are able to reduce or eliminate some of those other medications for mental health conditions?
I typically leave the prescribing of the mental health prescriptions to their provider that is prescribing those. But I have seen improvement where adjustments have been made in the medications, or even sometimes a medication being removed. Mm-hmm. Yes, I think that's very, very possible. And there's also a very good brochure that focuses on mental health and Lyme that's available for mental health providers. And we'll provide you the website for that or a copy of it.
On the website too?
Yes.
Okay, so with our resource list, we'll make sure to post that. Mm-hmm. So I just want to say thank you to both my guests today, Judith and Dr. Quattro, for coming in and talking about this very important subject.
Thank you for having us. I think it's such an important topic to discuss.
Yeah. Thank you. I know when I first was told that I had Lyme, I felt very alone. And so I would have been happy to hear a show like this. Do you camp? Do you hike? Are these things that you like? When you're done, check for ticks, lest they make you very sick. Lyme disease, babesiosis, Bartonella, anaplasmosis. All these things are borne by ticks. All these things can make you sick.
In Your Voice are short segments where listeners get to add their voice to the discussion. You can either call in to leave a message or record an audio file right on your phone. Either way, tell us about your mental health experience relating to the topic, share something that's contributed to your mental health recovery, or share a resource that you found helpful. Submission details can be found at ksqd.org/state of mind. Now we're going to hear from this listener who shared her experience of getting diagnosed and living with Lyme disease.
This is Terry from Santa Cruz. I was sick for 18 months before I got a diagnosis. I had incredible knee pain and swollen joints. I started to use a cane. It got so bad that for a while I was even using a wheelchair. I had an assortment of odd symptoms, numbness and tingling that would travel around to all parts of my body, and muscle twitching that did the same. There was a constant ringing in my ears like there was a freight train running through my head. I was extremely fatigued and had severe brain fog. An MRI showed demyelination in my brain. Both optic nerves were inflamed. Nerve pain from my knee to my ankle made even light touch unbearable. It was very anxiety-provoking to not know what was wrong. I was afraid I was dying. I saw 11 doctors before I got a diagnosis. There were many times I felt like giving up. After each time a doctor told me he didn't know what was wrong, or to come back when it got worse, or was only interested in treating the pain and not finding out what was wrong, I would despair. But eventually I would get the strength to go out and try again, hoping someone could help. Eventually I was diagnosed with Lyme disease. Because it had gone untreated for so long, it was in my central nervous system. I was treated with IV antibiotics. On the third day of treatment, I woke up and knew something was different, but couldn't figure out what. I finally realized that my head was quiet and the freight train running through it was gone. Then each day I got a little better. I was able to return to work, and I consider myself cured. It took a long time to fully recover. The Lyme spirochete had wreaked havoc on my muscles and joints. What helped in my recovery? Physical therapy 3 times a week in a warm pool, a therapist, supportive friends and family, and also what some people might call my stubbornness, which I prefer to call a strong will to never give up. For me, being cured is no longer having symptoms and pain and being able to live my life the way I want to live it. Being on disability for 11 months gave me a lot of time to think. I literally couldn't get off my couch. I realized I wasn't happy doing what I did for a living. I read practically every psychology book that was in the library and decided to become a psychotherapist. 9 years after my first symptoms appeared, I became a psychotherapist. I live with some residual arthritis, but it is easily managed. I wouldn't wish Lyme on anyone. I'm living proof that even out of terrible things, positive things can happen. I have a meaningful and stimulating career and a lot of compassion for people facing daunting medical conditions.
I want to say thank you again to our guests today, Judith and Dr. Cynthia Quattro, and thanks to you for joining us here on State of Mind, Being Human and Living Well. We've got some good news to share. State of Mind now broadcasts and live streams twice a month, so join us on the first Sunday and the second Monday of every month from 6 to 7 p.m. right here at K-Squid 90.7 FM. You can also listen to all the past episodes of this show or subscribe and get them delivered directly to your listening device on Apple Podcasts, Google Podcasts, Stitcher, Spotify, or listen through your home smart speaker by saying play State of Mind Podcast with Debra Sloss on TuneIn. Please help State of Mind episodes get heard by more listeners by leaving us a rating and a review on any of those podcast services. We also encourage you to check out our redesigned State of Mind program page at ksqd.org/State of Mind. The archive is now indexed, so if you're in any of the helping professions, teachers, nurses, doctors, therapists, or coaches can now browse all the titles by category to find just the topic or episode you're interested in. These shows can be a free resource you can share with your students, clients, or patients. And every show has a curated resource list posted with the episode. This is listener-supported community radio, KSQD Santa Cruz. Just remember, 90.7 FM, K-Squid, your ink spot on the dial. Stay with us.